DPT. Today I want to discuss with you scar desensitization. So sometimes if we have an incision, we end up getting very sensitive. So if we have our incision, today we're going to pretend that my incision's on my leg, but a lot of times in your back or across the elbow, or especially C-section scars, get very, very sensitive. And with that, what happens is you almost can't stand any clothing over top, or you can't stand anything brushing against it because it's extremely sensitive. What we want to do is to help desensitize that scar and make those nerves within that scar tissue less sensitive over time. So it does take a little bit of time. Anytime that you have a surgery, you're at risk for having that overstimulation that really increases the sensitivity in your scar. So the first thing is when you have a very sensitive scar, you want to gradually over time and very slowly use different tools that you have around your house. So today I have a cotton ball, and we are going to pretend that my incision is here on my leg, and I'm going to use this cotton ball very easily, gently, right across that area. Just very easy, up and down, making sure to go above that scar and below it. Now, once you can tolerate a cotton ball, you can increase to either a paper towel that's a little bit rougher on that area, or you could advance to using a washcloth. These two items are very good. You can even get this one wet with cold water, with warm water, because a lot of times too, that sensitivity is to different temperatures or even different pressures. So advancing from here, what I would use is maybe a loofah. So you could use that over top and always kind of going across. You can also go along with the scar incision, but going across is where those collagen fibers have really come together and they're kind of bundled up. So that just helps work through that scar sensitivity. Beyond this, you could take a butter knife or you could take a spoon, and this has different feeling because it's more firm and it's cold. So you can use it to poke, give more of a sharp type feeling, or you can use the other end and use more of a dull type feeling. Now, of course, you don't want to use anything too sharp that you could get injured. You can also use the handle and you can just glide across that incision to increase that feeling of coldness, that firm pressure. You can add a little bit more pressure to it, which also helps to break up any scar tissue that's located in there. A couple other things that I would like to mention is that if you're in the shower, you can use the shower nozzle to shoot water on the scar, and you can use a more prickly type that you could go along that scar. You can also use cold water and hot water to help desensitize. This happens to many patients after they've had surgery and they just can't quite tolerate any pressure and they don't ever feel like there's gonna be a relief from it. As long as you retrain the body, it makes the biggest difference. We can also use our hands, a lot of times our thumbs. If our incision is long ways this way, we would go across and do what's called a transverse friction massage. This also helps to break up the scar tissue in there because sometimes we get little adhesions, little scar pieces that kind of attach down into the muscle. So then anytime you would try to use that muscle, you end up having pain. So just a little massage across. And if you're trying to get rid of the visual look of the scar, you can also use vitamin E or cocoa butter and you can get tougher with that. So you can start out very easy, up above the scar, down below, and then you can get a little bit tougher with it. And that's going to help also with that desensitization. Hopefully this has helped you today, or you can pass this along to help someone you know. Have a great day.